This conference will now be recorded.
Good afternoon, everyone. This is the Whatcom County Health Department's media briefing for Monday, November 9th, 2020. This is Melissa Moran. I'm a Public Information Officer with the Whatcom County Health Department. We'll be hearing today from Erica Lautenbach and Cindy Hollinsworth of the Whatcom County Health Department. As we're getting started, just a reminder to go ahead and mute yourself. We will open things up for questions after we've heard from both of our speakers. At that time, we'll invite members of the media to type your questions into the chat feature, and we will accept those questions as they roll in. Also, another reminder that this briefing will be recorded and made available later today on the Whatcom County Government's YouTube channel and on our media page at www.whatcomcounty.us/COVID. And with that, I'm going to go ahead and turn things over to Erica to get us started.
Thanks, Melissa. Good afternoon, everyone. Thanks for joining us. I want to start by just sharing a bit of information about the disease activity that we're seeing and the increase in cases. And then I want to talk about holiday celebration guidance as we move into Thanksgiving, Christmas, and other holidays that folks are going to be celebrating. So first to start, we saw in October pretty low, pretty flat case rates, and we were encouraged by that. However, we did see that nearby counties and the statewide average continued to increase throughout October. And in early November, Whatcom has experienced an increase in daily case counts, and our 2-week rate is increasing. We are going to be watching to see if this continues to be a trend or if it's just a short-term increase. We are 9 days out from Halloween, and we tend to see increases following holidays and events where people are gathering. What we're seeing from the numbers, however, this morning is, and what we've seen in the last week, but increases, and we know we have at least 20 new cases today alone, many of them unknown as contacts or associated with a known outbreak. Of course, that will be reconciled and released in the data dashboard this evening, but we are seeing these increases that are concerning. We're hopeful that this isn't a part of the fall surge, but increasing case counts have certainly been a trend in Washington State and around the county. And I think it's important and worth noting that what we've seen in the last couple of weeks is almost 1 in 3 cases had a transmission or exposure event that occurred elsewhere in Washington State or out of state. So 2 of 3 are internal to Whatcom County, and 1 of 3 are outside of Whatcom County. And I think this is important because as people in Whatcom County travel to places with higher disease prevalence, their risk increases, and likewise with people coming from other places with higher disease prevalence, they bring additional risk. And I think it's just a reminder that we're not an island in Whatcom County, and the trends that we've seen statewide, we cannot be immune to as we move in and out of the county, despite our best efforts and despite people really taking this seriously and having good compliance. So it's just an important reminder that as as we travel to other places and as we celebrate holidays with family, the virus will cross borders with us, and that represents a real risk to our community as well. Also, we're seeing among the cases, about half of the cases are the suspected exposure setting was in someone's household. And of course, we have our isolation and quarantine available for individuals if they cannot effectively isolate or quarantine at home, but we are seeing a lot of household spread. And about a quarter of the cases, the suspected exposure setting was a social setting, about 28%. So that's a gathering or other social interactions. So as you can see, almost 80% of our cases are either within a household or within social gatherings. And a very small percentage of the other cases are either unknown or in a workplace setting, which could include the long-term care facilities that we've seen cases in, child care, schools, businesses, nonprofit organizations, etc. So we are seeing the bulk of our cases really coming from social and household contact. So moving on to celebrating at the holidays, I had hoped, and we all had hoped early on in this disease progression, that we would see changes before the fall. We had hoped that by canceling large-scale events in the summer and festivals and big gatherings, that we wouldn't also have to move forward with requesting sort of a change for our winter holidays. But that said, here's where we are, and we are recommending that people stay home to celebrate the holidays. We're recommending that people find other ways to celebrate holidays besides the typical large family gatherings, such as having a small dinner with only people who live in your household, or preparing traditional family recipes for families and neighbors, especially those at higher risk, and deliver them in a way that doesn't involve contact with others. However, we know that this has been challenging for people. We know that the longer time goes on, the social isolation and lack of social contact is really challenging. And we do want to make sure that if people do plan to get together over the holidays, they take cautions and certain measures. So, the gold standard is to do a pre-event quarantine for 14 days, strictly limiting contact with anyone outside your household, and asking your guests or those you're going to visit to do the same. We recommend that you have conversations with your guests or those that you're going to visit ahead of time about the ground rules and expectations about how you'll stay safe. And get really clear with friends and family about how you will make safety a priority by doing things like health screenings, wearing masks, limiting the group size, keeping windows open, or if you can, being outside, bringing your own food, and limiting what you share with others. While it's safest to stay home for the holidays, if you do plan to travel, monitor to see if COVID-19 is spreading in your destination location, and wear a mask and limit gathering sizes. If you attend a gathering or do plan to travel, consider quarantining for 14 days afterwards to ensure you aren't sick. And if you develop any symptoms of COVID-19, please get tested as soon as possible. Don't wait to see if it's the flu or a cold, or if the symptoms will go away. So this will be a different holiday season. It will require us to be creative and change our traditions, but it doesn't mean that we can't enjoy the people that we love in ways that can keep us all safe. So with that, I'm going to turn it over to Cindy Hollinsworth, our Communicable Disease and Epidemiology Manager at the Health Department.
Good afternoon. So I'm going to talk to you a little bit about COVID vaccine planning. The press release published today by Pfizer and BioNTech offers promising news that a COVID-19 vaccine may be ready in the near future. So this is very good news, but even while we wait with anticipation for a vaccine against COVID-19 to become available, we know that a successful vaccine is just the first step. And there are multiple critical components to vaccine implementation, even after a safe and effective vaccine is developed. In the early stages of vaccine availability, we will not have enough vaccine to offer it to everyone. The supply will be limited as production is scaled up and as the limited supply is allocated to states and local communities. As you've likely heard from the State Department of Health, when a COVID-19 vaccine is approved and released, we'll take a phased approach to vaccine administration. So phase one is when there's limited supply available. There will be highly targeted administration of vaccine to high-risk groups. And in Washington State, the possible priority groups identified at this time are high-risk workers in healthcare settings, high-risk first responders such as EMS, law enforcement, and firefighters, people of all ages with underlying medical conditions that make them at high risk for complications from COVID-19, older adults in congregate settings such as long-term care facilities, and essential workers such as transportation workers, food industry workers, school workers, and teachers. So federal organizations and independent national advisory committees are still finalizing their guidance on prioritization and allocation of the vaccine during this first phase. Phase 2 then will happen when there's enough supply to meet the demand. In this phase, most vaccines will be given through a network of provider sites such as pharmacies, primary care providers, community health centers, and even community or business points of dispensing or pods. And pods are clinics offered by private partnerships at community sites. The health department's role in vaccination is primarily to assess and monitor the needs of our community and ensure equitable access to COVID-19 vaccine services. So right now, we're working with local providers and the Washington State Department of Health to promote and monitor provider enrollment in the state vaccine program, which opened up last week and will continue for several weeks to come. In Whatcom County, we're lucky enough to have a strong network of providers. And when we look at how our community providers have really stepped up this year to offer flu vaccinations, it's encouraging to see. We expect we'll see the same kind of response for COVID vaccines, and that's good news for access to the COVID-19 vaccine for Whatcom County residents. We'll be continually taking a close look at provider enrollment in our county to identify any gaps in service, with the goal of making sure there's sufficient access to the vaccine for everyone in our county. We will develop plans to provide the service ourselves or develop local partnerships to do so. Typically, we focus our direct services here at the health department to those for specific communities or populations for whom there's a significant gap or who might face significant barriers to getting a vaccine through the usual systems. And we'll also be doing that for the COVID-19 vaccine. But it is possible that Whatcom County Health Department could offer mass vaccination pods if that's needed too. This is just an ongoing real-time planning process, and we'll continue to provide local updates about when and where the vaccine will be provided in Whatcom County as the details take shape. Lastly, what I really want to stress in all of this is that even once a vaccine becomes available, we'll need to continue all the other prevention measures for some time. We certainly look forward to a return to the many of the things we all miss, and a vaccine is a big part of that. As Erica reminded us, with the holidays coming, we're all going to be doing things a little bit differently this year. And I personally am looking forward to traveling and having big holiday gatherings with family and friends. But it's going to take some time for a vaccine to be available to everyone. So masks, staying 6 feet apart, and smaller gatherings still need to be our normal for a while longer. We're really grateful and proud of the way our community has risen to the challenges of this disease, and we thank you for taking care of one another by continuing to do these things, even when it's hard. So with that, I think I'll turn it back to you, Melissa.
That sounds great. We'll go ahead and open things up for questions. If you have a question, you can go ahead and type your name and affiliation into the chat feature, and we will call on folks as those questions roll in.
This is Erica. I should be I should know how to use GoToMeeting by now, but I accidentally just replied to all of you with a message that Melissa asked me to clarify some data. So I just want to, if you're wondering what the heck that chat is, the exposure data that I provided about household versus social versus workplace and unknown, that's data that we collected in October. It's not overall for the entire duration of this event, but it's recent data over a 1 week period in October that we were able to collect.
Thanks, Erica. We're also getting a question from Key Relia with the Bellingham Herald asking if you can repeat those stats about the infection rates that you shared at the outset.
Sure, yes. Let me just pull that up for you, Key. What we're seeing is half of cases, about 50% of cases, the suspected exposure setting was their own household. A little over a quarter of cases, so 28% of cases, the suspected exposure setting was social setting. And then I also shared that about 1 in 3 cases had a transmission exposure outside of Washington State or elsewhere in Washington, not in Whatcom County.
And Key, if you have any follow-up questions, feel free to unmute yourself to ask those as well. Our next question is from Robert Mittendorf with the Bellingham Herald. Robert asks, when do you think we'll start seeing vaccine available here?
Oh, yeah, I don't know that we have that information yet, and that's what we're just waiting for information to come. That's the equitable distribution part, that we should see all communities having access to some vaccine at the same time as soon as it's publicly available.
I think it's also worth noting that the vaccine will be available globally, and there will be in the beginning a very limited supply as they ramp up the supply chain. So we're not just talking about supply within the United States, but with the large populations in other countries as well. So we don't have a timeline, but we definitely know it's going to be some time before widespread vaccine is available to everyone.
Thanks, Erica and Cindy. I don't see any other questions rolling into the chat here, so I'll go ahead and make a call for any questions. If you do have a question, feel free to unmute yourself and ask that question now. If we don't see any more questions rolling in, we can go ahead and end things for today. We do have a question coming in from Key with the Herald. Key's asking, can you talk a bit more about the effect of schools being back in session? What kind of an impact is that having on case counts? And Key's saying by schools, referring specifically there to public schools.
You know, we're watching the ages and connecting those to schools. We're certainly seeing some kids that are contacts of cases from household exposure. So that's disruptive, and those kids having to stay home in quarantine when they might have been getting back to school here this month. We're seeing some cases in adults that work in the school system. So some limits there, but and so we're continuing to do our education and contact tracing processes.
And just to add to that, I do think it's just important to note once again that we are seeing the bulk of our cases outside of work in organizational settings, but social and household settings. So just worth noting again.
Okay, I think we'll do one last call for questions. It looks like all the questions have been asked and answered, so we will go ahead and end this for today. Thanks everyone for joining us. Take care.